Everybody, it's me, Courtney Francois. I just want to do a quick video about endometriosis. So, endometriosis is a condition. I guess not a disease. It's a condition where the tissue that grows inside of the uterus, it begins to grow on the outside of the uterus. Now, the issue with that is we have these monthly periods, and the lining and the tissue of the inside of the uterus is sheds, and then it comes out with the menstrual cycle. But the tissue that grows on the outside, it has nowhere to go, which causes inflammation and irritation and lots of pain. So, first off, we're not even supposed to have periods like that anyway. We're only supposed to lose a little bit of blood. It is just a tiny microscopic egg, but that's a whole different video. We're not going to get into that. So I found out about endometriosis after I had my second son. It was like 2-3 days. No, you stay in the hospital about 2 days. So maybe 2-3 days after I came home. And I started having really bad pain in my stomach, and I went to the hospital, and they kept checking. Then they were like, we think it's endometriosis. And they kept me in the hospital for a couple of days because the medicine, I had to get it through an IV. Now, no one explained this was a condition. Like, I thought it was some type of infection after giving labor. That's what I thought. But no, obviously it's a condition, something that's going on in me. So in 2016, December, I had my fallopian tubes removed because I feel like I kept having high risk pregnancies, and I was about to be 30, and I just felt like I was not about to be in my 30s going through difficult pregnancies and possibly dying. So I had my tubes removed, and after I had my tubes removed, I started having super painful periods, like horrible periods. Like, I'll throw up, I'll pass out, and it's usually the first 2 days. Super painful. And I didn't know what it was. So a lot of the time, recently, I was telling everybody, do not remove your tubes. You're going to be in so much pain. And then when you go to the doctor and talk to them about it, they say it's common in women. Like, yeah, usually after women remove their tubes, they do experience a lot of pain. It's like, well, why didn't you say it in the beginning? Why didn't you let me know all these other risk factors? And then all they do is try to get you to get on birth control. Like, well, we can give you some type of pain management, or you get on birth control, and that'll help with the pain. It's like, well, I took the tubes out because I didn't want to have kids. I didn't want to be on birth control. I don't want that. And then the doctor tried to give me birth control and want me just to be on the active pills, so we don't have that week off where I have a period. Just want me to stay on active pills so we eliminate the period completely. See, the thing about birth control helps with acne because it's different hormones. So it definitely helps in that aspect. But when I used it, my experience, it made my vagina dry. So it's like, which one do you want? Do you want a clear face, or do you want a dry vagina? So it's like, I think I'll just pick the acne and go back to a moisturized vagina. It's so many different things. It's all chemicals. It's like, no thank you. I'm trying to be chemical free here. So the thing with endometriosis is the scar tissue, it can make organs, they can connect together, be stuck together. It can also close your fallopian tubes, causing infertility. It can cause things like pain with urination, pain with bowel movements, nausea, fatigue, mainly just pain. And the pain management they're going to try and offer you is, like I said, birth control, maybe some type of, tell you to take some ibuprofen 800s or something like that. They can do surgery and cut off those nerve endings for where you feel the pain. They can do a hysterectomy and take out your uterus. They can take the ovaries out. It could be a lot of cutting going on here. They want to do a lot of surgeries. And then I found out that my mom and my granny had endometriosis. I did not know this. And my mom had a hysterectomy due to the pain, or a partial hysterectomy. I think my grandma did as well. And it's like, I already removed my fallopian tubes. I would like to keep my uterus. It's like, what if? I can still get pregnant. Just because I don't have these tubes, there's a possibility of me still having a baby. So I would like to keep my uterus. There's a chance. It's just taking out all my lady parts. I don't want to do that. That's not fun to me. So endometriosis is a very painful thing. It's a very common thing. And then they said some doctors, it take them 5 or 10 years to even diagnose you with. They'll just keep saying you have painful periods and all this other stuff. And then later on, like, you know what? Maybe it is endometriosis. Maybe it is. And it's like, I don't want to wait that long. Just like now, no one is, even with me having this pain, no doctor has diagnosed me with endometriosis. Even with me being in the hospital that one time for what I considered an infection, and it's in my file, no doctor has been like, oh yes, your pain, we see you've been here for endometriosis. That's actually a condition, and it's something they're dealing with. It also says that you can have cysts on your ovaries, and they're little chocolate covered cysts. I watched some videos, and then when they cut it, chocolate colored fluid comes out, and it's like, And I remember once I went to the doctor and they said I had a cyst on my ovary, and I was like, so what are we gonna do about it? Is there gonna be a surgery? And it was just like nothing. It was just like, yeah, it's a cyst. And then you start Googling stuff like, isn't a cyst a problem? But I don't know. It depends on the doctors. It depends on how much they care. I guess some doctors care more than others. Some take things very serious. Some don't. No one really cared about this endometriosis, I guess. They gave me the medicine to get me better, and shit, it was never talked about again. Like, even when I went to see my regular doctor after, she was like, oh, so you were in the hospital for endometriosis, huh? And I was like, yeah. And like, that was it. There was no explanation. Like, do you know what it is? Do you know? Have you had these issues before? Because it says usually you have pain before. And my mom said I used to have pain when I had periods when I was a teenager, but I don't recall this pain. It can also cause pain during sex in your pelvic area. And I know more recently, like after I removed my tubes, I would have pain in the pelvic area, and I would think it was just because we were just doing too much while having sex. But no, obviously it's the endometriosis causing the pain. I mean, it's like some severe pain in the middle. It's like a cramp. It's like, wait, stop, ow. So yeah, it's not fun at all. So this was just a quick video to give you guys some information on endometriosis. If you are having painful periods, because pain is not normal, you're not supposed to be having pain during those periods. And if you've been dealing with it for a long time, we're in our 30s and stuff now and it's still going on, most likely it's endometriosis. But at the same time, there's not much we could do about it unless you're willing to go get like a hysterectomy or go get some surgeries and get some things taken out, cut off, or unless you're willing to take birth control. I don't know how it's going to affect your body, but I know it made my vagina dry. And then I was using lubricants and stuff. Who wanted to do that? That was not fun, so we just stopped the birth control. Like, well, no, what's the pull-out method? But anyway, so maybe you want to do the birth control. Maybe that'll be okay for you. That wasn't okay for me. I mean, maybe they'll have some type of pill for you, ibuprofen 800, or because now on my periods I take the Tylenol 650, and that it doesn't stop the pain, but it simmers it down. So yeah, it's not really a solution for the endometriosis, like I said, unless you're gonna get a hysterectomy. I don't think you're not having a period anymore, you don't have it. Yeah, so that's really like the solution. But who really wants to have all these surgeries and just take out their lady parts, or we could just deal with the pain? Like right now I'm just dealing with the pain. It's like, it's not every month, it's like every other month, and it's painful the first day, the second day, but I mean, hey, I make it through it. I pass out, I throw up a little bit. Hopefully I'm not at work when it starts. Hopefully it's like an off day. And that's the thing, if it's when I'm at work and then it kicks in, if you feel it starts with light cramping. So it's like, and sometimes like I forget I have a period. It's like, man, my stomach sure does hurt. I was like, what did I eat today? It's like, duh, Courtney, the period's coming. The pain is on the way. This is brewing up. So this was that video on endometriosis. I mean, you could look it up. You could do more research on it if you think you may have it because you're having very painful periods, or your girlfriend or your mom or whoever, your little cousin, and let them know that, hey, you may have a condition. It's painful all the time. It hurt real bad. You be sick. Yeah, probably endometriosis. So you guys have a wonderful day. I'll see you later.